Hello everyone, I'm RUSS McLEAN, Chair of the Pennine Lancashire Patient Voices Group, and today, Monday the 30th of January 2017, I'm in conversation with Mr Kevin McGEE. Welcome, Kevin.
Thank you, Russ.
Kevin's the Chief Executive of East Lancashire Hospitals Trust, a trust based in Blackburn, Lancashire, which has a large health portfolio, including 3 community and 2 acute hospitals, amongst other things. Now, we meet in the first month of a new year, 2017, a year which I believe will be not only a critical turning point for the very existence of the NHS, but also for sweeping changes and perhaps cuts to services. The press seems to be full daily of stories detrimental to our health economy. The Prime Minister, Theresa May, and her Health Secretary, Jeremy Hunt, seem to be in denial about some of the problems facing our hospitals. And more recently, she launched a scathing attack on our GPs and primary care. All across the country, there are trusts who continually failed to meet their 4-hour targets. Ambulance crews complaining that they are unable to hand off patients and therefore missing their response times. There are patients facing long periods on trolleys in hospital corridors. Operations are being cancelled, often on a number of occasions, and locally we have A&E closures, a deprived and ageing population, and a social care system that's been decimated by the lack of investment by successive governments. We have sustainability transformation plans which seem to lack substance and drive, and which to the cynic might very well look like a smokescreen for the cuts that everyone knows will have to be implemented if the NHS has any chance of surviving. I'd like to pick up on a couple of those issues, Kevin, if I may, by discussing perhaps the travesty of patients having to wait for long periods of time on trolleys and corridors. No matter what the reason, this isn't acceptable on any level, is it?
It's not acceptable on any level, and on the occasions that we have had patients waiting on corridors, certainly I would like to apologise to those patients and the families, but what I can say is that on all occasions that has happened, we always look to do everything we possibly can to maintain the safety and the dignity of patients and their families. So we always have what we call corridor nurses. We will never leave patients unattended, and we always have the options of staff and admin staff supporting patients and the family by offering teas and coffees and sandwiches, and just to make sure they have all the appropriate information. So you're absolutely right, it's not acceptable for people to be on corridors. Unfortunately, over the last few weeks, because the numbers have been so high trying to access our A&E departments and we only have so much physical space, it has happened on occasions, but on all those occasions we've done everything possible to keep patients safe and well.
Is it going to be happening in the future?
I will try and do everything that is possible with the physical capacity that we have, with the doctors and the nurses that we have, to ensure that it doesn't happen, but I can't guarantee that it won't happen again. We have an ageing population, but not necessarily a population that's keeping well. We have increasing demands from all our age groups for the use of our services, and you might be interested to know, in actual fact, the highest users of our A&E department are the 20 to 29 year olds, and the second highest users are the 0 to 9 year olds, many of whom are the children of the 20 to 29 year olds. So people's expectations, quite rightly, of what we can do and what we can deliver are growing. So those pressures will be with us. What we have to do is try and have the right doctors and nurses and physical capacity in place to be able to manage that. But what I can't do is just magic that up immediately. We have to work long term to look at the numbers that are coming through, to ensure we train the right numbers of doctors and nurses, and to make sure we have the right physical capacity.
Well, let's pick on a point you mentioned about this certain age group being the most frequent attenders at A&E. What do we need to be saying to those groups of people about coming to A&E? Because I know inappropriate attendances isn't a term that anyone likes to use. Sick people obviously need to go and be somewhere and be seen, but not everyone that comes to your A&E needs to be here.
I think what's important to recognise is that what we have seen is a lot of very sick, poorly patients turning up. So it's not that we've seen large increases in inappropriate numbers. We've seen an increase in numbers, but of really poorly people. And the number of people who've become by blue light ambulance conveyors has increased. So there is something about the population ageing, population becoming poorlier. But you're right, there are still patients who turn up and they shouldn't be here. And why anybody would want to come to an A&E department if they don't need to be here, I struggle with, to be honest, especially when there's other options such as walk-in centres, such as pharmacies. There are other options that people can consider. So if you don't need to come to urgent care or an A&E department, please think about it and think of the other options.
The issue of patients in corridors was highlighted by local and national press, newspapers, radio and television after a patient shared their mobile footage with them, and it was footage obviously filmed in this hospital. I'd like you to sanction this. I'd like to remind our listeners that recording in a private place is unlawful without permission. But not just that. I mean, come on, it's immoral too. Hospitals are full of vulnerable people who have a right to privacy and dignity. What would you say, Kevin, to anyone considering the use of recording to highlight an issue?
I have to say we found that action difficult to take. It really felt as though it undermined staff. It was a very busy night then, but the actual footage, if you look at the footage, although it shows a very busy department, it actually shows a department that is being managed and is calm. What I'd say to people, if you are concerned about the length of wait, there are other actions that you can take rather than just filming, and we have a complaints process and procedures that people can go through. I think we're all in this together. We do not want patients waiting longer than they have to. We do not want patients on corridors, the same as people who come into our hospitals. But at very, very busy times, there may be occasions where we just do not have the physical cubicles to treat everybody separately. And therefore, what we will have to do is manage that by having patients on a corridor, but always looked after appropriately by clinical, medical, nursing staff.
This month saw the 70 student nurses start their clinical placement within the trust, so congratulations first of all on that.
Yes, it's great. I mean, we are a really big hospital for training doctors, nurses, all groups of staff, and the students that come through are really the lifeblood of the organisation because they have the training here, and hopefully most of them will have a good experience and therefore want to come back and work here once they're qualified. So training of all disciplines is really important for us.
I guess that in a large organisation such as East Lancashire Hospitals Trust, over 7,000 staff I think on the payroll, would it be fair to say that the workforce can be quite fluid, and what sort of challenges does that in itself present to the trust?
You're right, it can be fluid, but we have one of the lowest turnover rates in the Northwest in terms of staff, which is good. But some turnover is important because you want new people coming into the organisation with new ideas and can bring new things into the organisation. So I would always want some turnover, but it's really important though that we have the vast majority of our staff who are committed to this organisation and want to work and stay in this organisation, and that's what we get by and large. So most of our staff live locally. Most of our staff, they and their family use these services, and it gives them a real affinity and a commitment with what we do. And I think that's why we've got such really good services.
Are staffing levels safe on all your wards at the moment?
So what we do, we monitor every shift in terms of staffing levels, and we always have the appropriate number of staff on the wards. Sometimes we have to go out to agency to try and get the staff in to cover if there's gaps, and very occasionally we do get short-term sickness, so there are occasions when we might get 5 minutes notice that somebody isn't turning up. It's not always possible to cover with such short-term notice, but our staffing levels are good, and we work really hard in terms of use of our agency and bank staff to make sure we have proper coverage.
Let's pick you up on agency and bank staff. And a couple of years ago, there was quite a furore when we looked at the board papers, discovered that year on year there's been a huge increase in the amount of agency staff you're having to use. Are you still in that position? Are you still having to use large numbers of agency staff?
So that we still have agency staff within the organisation. I can say some of that is good because if you think about a hospital, activity in terms of patients that come goes up and goes down, and it can be seasonal. In winter it's normally busier, and therefore you want some flexibility and you want some ability to use agency staff. But it has been going down, and it will go down by about 3 million, we think, this year in terms of our forecast. So it's something we're working very, very hard on. But I have to say in some areas, because there's a national shortage of some doctors and nurses in some areas we do use agency staff.
We've spoken on a number of occasions about your A&E and the fact that you're not meeting your 4-hour target. Actually, congratulations, you met that, I believe, last Thursday.
We did, but you are right, we haven't consistently hit the 95% target, and it's something that we're working very hard to make sure that we can do in future. There's a lot of changes going on, a lot of developments going on, both in terms of our A&E department itself, but also the hospital wider, and also social care, because if you think about it, the 95% target is actually a very clever target because it manages everything and picks up everything that goes on in the hospital. So if primary care isn't working, you'll get too many patients turning up through A&E. If social care isn't working, you won't get the discharges that are required. If the hospital isn't working, you won't get the flow. So it is actually quite a clever target that picks up how the whole health and social care system is working.
But these days, with the way things are in health and social care, do you think that that's a realistic target anymore? And would you like to see better or improved methods of reporting?
Well, I think we need to do both. I do think the 95% is an important target because, as I said, it's a whole systems measure. But there is a piece of work going on nationally to look at what other things we can count in terms of A&E. So if you look at some of our other indicators, we do really well. So one of the key things is, has there been any 12-hour breaches? We have very few 12-hour breaches. We do have some, but we have far less than most hospitals, which is a good indicator. Another good indicator is hospital turnaround times. So how long does it take for a blue light ambulance that comes into an A&E department, how long does it take for that crew to discharge the patient into the care of the hospital? There's a target that's set of it should be no more than 30 minutes. Nationally, this is a really difficult target, and many trusts are not hitting this. There are times when we don't hit it, and that's right, but again, we do better than most in terms of our ambulance turnaround times. So it is something we focus on. So I think the 95% target is important and it's good, but there are also other indicators that we need to look at as well, such as 12 hours and ambulance turnaround.
And I think at this point it probably would be fair to remind our listeners that the ED, the Accident and Emergency Department here at the Royal Blackburn Teaching Hospital, isn't just the busiest in Lancashire, it's the busiest in the North West. Why is that, Kevin?
Well, if you think about it, if you go into Manchester, there's a number of hospitals in much shorter geographical area to one another, whereas we cover a population of 550,000. So that's a massive population area that we cover just for one A&E department. So, you're right, we are the busiest ambulance blue light conveyance hospital in the Northwest, by some distance I may add. We are incredibly busy, but I'm immensely proud of our A&E department. I'm immensely proud of the staff that work in our A&E department. And, you will find it even in the most difficult times, the care that we provide and the professionalism and dedication of the staff, it really makes you humble.
Of course, locally we've had the closure of Trolley A&E, Trolley Accidents and Emergency, which has recently opened again part-time. Have you been able to ascertain whether or not that's had a significant knock-on effect, as to how busy you are in your own A&E department?
It's difficult to get precise numbers. I mean, there has been a small impact, we think, but I have to be fair, I don't think it's been, a massive impact, but I do think there's been a small impact of a small number of patients each day who may have gone to A&E in Chorley and come here. And the reason I'm saying it's difficult is if you think about the borders and where patients may come from, would they historically have gone to Chorley? Would they historically have gone to Blackburn? It's a choice where they could go to. So we haven't seen a massive increase in numbers. And I would not like your listeners to think in any way, shape or form the changes in Chorley have significantly impacted upon us. It's only been at the margins.
You will no doubt have heard the news that Accrington Victoria Health Access Centre will not be recommissioned when the current contract expires. Over the last 12 months, this service has seen over 40,000 patients, and that's in addition to the patients that you see yourself in your minor injuries unit, which operates from the Accrington Victoria Hospital. Over the Christmas period, you had to close the minor injuries unit again, and when the walk-in centre closes its doors, where on earth, Kevin, are these patients going to go? I'm very fearful that they'll head to your A&E, which is already struggling to meet demand. How worried are you?
So I do have some concerns. We are working with the CCG Commission is to try and understand what the impact will be. But you are right to express that concern, and I also share some of those concerns. What I can say is that we are working closely with the CCG. We are trying to understand what the mitigating actions will be, and I would hope that they would not do anything that would increase the pressure on our A&E department here until we put those mitigating actions in place.
What contingency plans are there in place here at the Trust in case there were a large influx of patients? Do you have contingency plans?
So physically we are constrained. I can't just open more cubicles because we physically don't have them. So what we're doing is we're working on both a medium term and a longer term plan to increase the physical capacity that we have to cope with both urgent care and A&E attendances on the Blackburn side. So there is some work that we're doing in the medium to longer term, but in the short and immediate term I'm very limited in terms of the physical capacity that I have. Therefore, if and when the unit in Accrington closes, we need to ensure that there are other options for those patients to go elsewhere.
And I think it would be fair to say from a patient's perspective that those options really aren't in place yet. Alarm bells seem to be ringing across Hyndburn, with many residents fearful that this might be the beginning of the end for the beloved Accy Vic. Of course, it's been around forever. Is the total closure of Accrington Victoria Hospital something that Trust is looking to do in 2017?
It's not on the cards at all. And you know, when I go out to Accrington Victoria, you can tell it's a really important facility for us. There's some great services that are provided from there. The staff that work there are brilliant. So we have a minor injuries unit there, and it's our intention to keep that minor injuries unit there and to work with it. And we also have other services there, so outpatients, diagnostic services, an inpatient ward. And we have no plans to close Accrington Victoria at all. What I can say is that clearly healthcare and how healthcare is delivered is continually changing, and it will need to continually change to meet the needs of our population. But I see a role for Accrington Victoria going forward.
We hear the NHS talking about winter pressures and inference that during winter there's a significant rise in attendances and activity, but of course this is slightly misleading because the NHS is under winter pressures every month. What do you think is driving this demand, Kevin, for services, for secondary care services? And in an ideal world, if you could have the opportunity, what would you say to those in government must be done to improve that situation?
So that is quite a big, complex issue. I wish there was one simple answer to it, and there isn't. So, going back on what we've already talked about, we do have an ageing population, but we don't necessarily have a population that's ageing well. So we're getting more and more people over the age of 85 who are coming into hospital very poorly with many comorbidities. So there's a real issue there. The expectations of what the NHS can do for the younger population is growing. And quite rightly, people's expectations of what we can do and deliver are high. But we don't always have the capacity to keep up with that. There are then issues in terms of how the whole health and social care system works together. So we do know there are pressures on social care, and I don't think anybody could deny that. The pressures on social care then mean it can be difficult for hospitals to discharge patients. So we've got to work on all of these fronts. We've got to think about how do we keep people not only living longer, but living longer better. We need to think about the expectations of our population, and can the NHS deliver everything that everybody wants? And we need to look at the whole system, not just the hospital bit. And we need to think about how health and social care can work better together in future. And personally, I would like to see health and social care under one umbrella. We are so closely linked now, and we need to work so closely. To have boundaries and barriers between us doesn't help.
You've personally worked in health for different trusts for a number of years, so you'll have seen the changes come round and go round and round again. How worried are you personally that the NHS, and not just your trust, but about the whole health system, how worried are you that it's going to have significant changes to survive into the future?
Well, part of my job is to be worried. I mean, you would not want a chief executive of your hospitals who was complacent. So my job is to be worried and to always look for the future and what's going to happen. And the health service will have to change. People's demands of the health service are growing. Are
they unrealistic?
I think that's a bigger societal question, not one that I can answer as a public servant. You know, we have to, and I have to, as the Chief Exec of East Lancs Hospitals Trust, manage and try and provide the services that our population demand and our population want, and we will continue to do that. But there are some real challenges that we face in the NHS. So there are some workforce challenges going forward. We're not training the doctors and nurses that are going to be necessary at this point for the future, so that's going to cause some pressure. It's going to be difficult to maintain all of the services that we currently have in all of the locations, and so there's going to have to be conversations about what the services look like going forward. And there is this thing, I do think people are going to have to take more responsibility for keeping themselves healthy and well longer and better, because the NHS is not going to be able to provide everything to all people.
For 2 months now, the media focus on the NHS has been quite relentless. There is, unfortunately, as always, a negativity directed towards the NHS. Do you feel that this negativity has a direct impact on the morale of your staff? And how on earth do you keep staff motivated to continue to provide that safe, personal, effective care?
Well, clearly it must do. And, I know staff, there have been days over the past few weeks when staff have been quite low because it has been quite relentless, the pressure through A&E, not just through A&E, through all of our wards and departments. And then, when there's negative publicity all the time, then clearly it's going to have an impact on staff. What we've tried to do is just be very open and honest. So, for instance, we're actually working with the BBC at present, who are doing a piece of work looking at our A&E department. And what that's really showing is, yes, it's an A&E department that's under pressure, but it's an A&E department that the staff are working incredibly hard in. It's an A&E department that is well managed, well controlled, and is calm in spite of the pressures that are under. So I think it's really important that we get the balance right. We recognise that the services are under pressure, but we also recognise that staff are working incredibly hard to cope with that. I think, all of us, in our communities, have a need and necessity, and we should have an obligation to really support our NHS staff, because they come in, day out, doing the most difficult jobs in some of the most difficult circumstances, and we should be really proud of them. From
a patient's perspective, the staff do work very hard, and this hospital has come a hell of a long way in the last 2 or 3 years. You recently announced that the Trust Board would be embarking on an equality and diversity initiative to ensure that these ideals are embedded within the organisation. Can you tell me more about what equality and diversity means to you as a chief exec?
So we serve to represent the communities, and we're here to represent the communities that we serve. It's important, therefore, that we, as an organisation, should understand those communities and should reflect those communities. So, for instance, that we need to ensure that we have, throughout the organisation, we have the right mix of diversity, whatever that means, in terms of race and in other areas. And it's really important that we do that, because that will allow the organisation to make the right decisions. It will allow the organisation to represent its communities better, and ultimately it will allow us to deliver better services.
Well, staff at East Lancashire Hospitals NHS Trust are keeping their promise to provide safe, personal and effective care, with the news that no hip fractures were recorded on any of its wards in the last 3 months. So first of all, congratulations. A recent report published by the Nuffield Trust found that the number of hip fractures, also known as fractured neck of femur, in England has increased by more than 15% due to the increase in numbers of very old people. So we will have to say a very, very well done to East Lancashire Hospitals Trust.
Yes, no, thank you for that. And again, this is just an example of how we have to work day in, day out, with every member of staff being vigilant. We have the right processes and procedures and training in place, but more importantly, we have the right culture in place, that staff really focus on keeping our patients safe whilst they are in hospitals and doing the very, very best for them. And you're right, East Lancashire Hospitals have come a long way over the last 3 or 4 years. And I think our communities should be really proud of the services that are delivered on their behalf.
And we should mention that there is more to be proud of, in that the Trust has 6 nominations for Health Services Journal Value in Healthcare Awards. How, as a Chief Exec, how proud does that make you feel?
Very proud. I mean, I think one of the things I observed when I came to East Lancashire is that we did a lot of things really well, but we never celebrated it. And I think one of the things, going back to your previous question about how do we keep staff morale up, is actually to celebrate what we do well. And we have some of the best, most innovative services in the country in East Lancashire in our hospitals. And so things such as these national awards, and the very prestigious national awards, it's important that we put bids in to try and win those awards, because that gives staff a real sort of fillip. It really helps the morale, and it's a true reflection of what we do.
And of course, the Trust reintroduced the Star Awards. You'll have to forgive me, I can't remember the acronym for now. But we've got the Star Awards coming up, which again is another way that the Trust is able to celebrate the achievements of staff.
Indeed, and we have many different categories for staff. So we have individual awards for clinical and non-clinical staff. We have team awards. We have unsung hero awards. We have volunteer awards, and it's really meant to represent, and for staff themselves and for the public to vote for our staff, and to recognise and to celebrate the great work that goes on day in, day out within these hospitals and community services.
And of course that has also been noted by the Care Quality Commission, who've recently had a well-led review and inspected the hospital. On the 20th and 21st of September last year, East Lancashire's Hospitals Trust received the brilliant news that it's been waiting for, that the Trust has now been rated as good overall. So that, again, must make you feel very, very positive and proud.
It does, and this is a really important. This is really important for us, because if you think of where the Trust was 3-4 years ago, it was in special measures, and that was as a consequence of work that the CQC did. We've been on a journey then that took us from out of special measures into requires improvement, and now to be recognised as having good services throughout all of our hospitals and community services, I think is really, really important for us. We don't stop here. The next thing I'd like us to do is to get to outstanding, and that's the highest that a CQC rating you can get. I think it's possible that we can. Some of our services and some of our activities are already rated as outstanding, and I would like to get that across the board in everything that we do.
And of course, it's no secret that in the past I haven't been the Trust's biggest fan. However, I hope I've become a critical friend. So on behalf of the patients I represent, I would like to take this opportunity to thank you, your staff, the board and the managers, and each and every member of staff who work here within the Trust to provide care to the citizens of Pennine, Lancashire. Hope that during 2017 that we can continue to work together to improve the health of our population and rest a little easier, perhaps, Kevin, with you at the helm. So happy New Year 2017, and all the best to you and the staff for the future.
Happy New Year to you, Russ, and all your listeners. Thank you.